Assalamualaikum, my name is Nushahira binti Saharan and I'm going to explain to you about the theory of bureaucracy for the introduction. Basically, according to the Max Weber, the best of the most effective way to handle organization and administration is use bureaucracy. In bureaucratic company, everyone will be treated equally, and the main concept of bureaucracy also can be defined as the clear hierarchy organization. All decision making is based on the set of regulation, rigid division of labor, formalized of authority, and impersonal interaction between employees, whether it's a public or the private. And lastly, the Max Weber also established of bureaucratic ideas such as delegation and allocating specific works or responsibility to specific domains, providing a suitable work guidelines, and hiring people based on the merit and qualification. That's all. Assalamualaikum. So for our topic, we choose the public organization, which is Ministry of Health or MOH. For the history of this organization started before the country independence. At that time, the hospital aimed to treat thin mind workers, and for the treatment cost 50 cents per year. For example, Tapah and Teluk Intan Hospital. Next is the spread of malaria and beriberi sickness prompted to establishment of the Institute for the Medical Research or IMR in 1990. The goal of this organization is to do research on the sickness and how to treat it. Next, the MOH also built a first government dental facility in Kuala Lumpur in 1929. As the result, MOH can improve resident health. And next, MOH also have a dental service, established the College Latihan Jururawat Pergigian in Pulau Pinang in 1949 to train nurses, dental technology and surgical assistant. The government also approved 5 college science kesihatan bersekutu KSKB facility under MOH under the 7 Malaysian plan. This college is located in Sungai Buloh and Johor Bahru. The goal of KSKB is to conduct a semi-professional health science academic training program in response to need of human employment, particularly in the field of the health science. In addition, Ministry of Health also in the process of improving its health service for the citizen after 20 years after independence, which is 1957 until 1977. For example, they have a clinic kesihatan kecil and clinic PAD. In 1974, the Paramedical Service Division was founded to provide Malaysia.
Next, I will explain about Profile Ministry of Health Malaysia, which is called MOH. The objective is to assist an individual in achieving and sustaining as well as maintaining a certain level of health status to further facilitate them in leading a productive lifestyle economically and socially. This could be materialized by introducing or providing a promotional and preventive approach other than efficient treatment and rehabilitation service, which is suitable and effective with priorities on the less fortunate groups. Vision MOH is a nation working together for better health. The mission of the Minister of Health is to lead and work in partnership, is to facilitate and support the people to attain fully their potential in health, appreciate health as a valuable asset, take individual responsibility and positive action for their health. Next, to ensure a high-quality health system that is customer-centered, equitable, affordable, efficient, technologically appropriate, environmentally adaptable, and innovative. Lastly, MOH also gives emphasis on professionalism, caring and teamwork value, respect for human dignity and community participation. There are many departments in MOH. Among them are Jabatan Kesihatan Negeri Johor, Jabatan Kesihatan Negeri Kedah, Jabatan Kesihatan Negeri Kelantan, and etc. Not only that, MOH also had a lot of institutions. Among them are Institute for Health Behavioral Research, National Cancer Institute, Institute for Public Health, Institute for Health Management, Institute for Medical Research, and etc.
A procedure is a well-defined way for completing a task. usually consisting of steps that must be completed in a specific order. Ministry of Health has their own procedure to make sure that their organization will run smoothly according to the plan. Their general procedure in managing the administration is letter and document, which every letter and document are supposed to arrange according to the specific files. Ministry of Health employees should have worn an appropriate clinical attire such as masks, long-sleeve apron, surgical cap, and rubber gloves in handling situation and change only when they left the building. Ministry of Health have to make sure all usable and medical objects must be completely decontaminated before use. Ministry of Health need to ensure that vaccines are stored and administered according to the manufacturer instruction. Last but not least, Ministry of Health employees are obligated to use friendly language and assist customers without racial and religious discrimination.
Graph of COVID-19. Malaysia first enacted a partial lockdown on 18 March and has since extended the initial 2-week MCO twice. Going into phase 3 of the MCO, authorities hope that this could break the chain of infection and flatten the curve. Coronavirus disease COVID-19 is an infectious disease caused by the SARS-CoV virus. Most people infected with the virus will experience mild to moderate respiratory illness and recover without requiring special treatment. However, some will become seriously ill and require medical attention. Older people and those with underlying medical conditions like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. Anyone can get sick with COVID-19 and become seriously ill or die at any age. The best way to prevent and slow down the transmission is to be well informed about the disease and how the virus spread. Protect yourself and others from infection by staying at least 1 meter apart from others, wearing a properly fitted double mask, and washing your hands or using an alcohol-based rub frequently. Get vaccinated when it's your turn and follow local guidelines. The virus can spread from the infected person, mouth or nose in small liquid particles with their cough, sneeze, speaking or breathe. These particles range from large respiratory droplets to smaller aerosols. It is important to practice respiratory etiquette. For example, by coaching into a flexed elbow, and stay home and self-isolate until you recover if you feel unwell. Coronavirus COVID-19 vaccination. 56% of the world population has received at least one dose of a COVID-19 vaccine. 8.43 billion doses have been administered globally, and 33.01 million are now administered each day. Only 7.1% of people in low-income countries have received at least one dose. Fully vaccination. But it's not vaccine that will stop the pandemic. It's vaccination. We must ensure fair and equitable access to vaccine and ensure every country receives them and can roll them out to protect their people, starting with the most vulnerable. To be fully vaccinated, you will need 2 shots of some COVID-19 vaccine, booster shot and additional primary dose. A booster shot is for people who with enough protection after completing their primary vaccine series, but then the protection decreases over time. Everyone aged 18 years and older who have fully vaccinated is eligible for a booster.
Several points show the advantage Ministry of Health of Malaysia MOH or Kementerian Kesihatan Malaysia KKM to Malaysia. The first is better performance shown to the people. This can be seen when our country is hit by an epidemic that threatened the whole world, namely COVID-19. The MOH took drastic steps to deal with this COVID-19 pandemic. Among them is Prime Minister announcing the Movement Control Order (MCO) at an early stage. On March 16, Prime Minister Tan Sri Muhyiddin Yassin announced that the government had decided to implement the Movement Control Order from March 18 to 31 nationwide. Then the second advantage is higher productivity. This can be seen when the readiness of the MOH in dealing with the spread of COVID-19 in Malaysia. Among the precautions provided by the MOH is to increase energy resources. We can see that when the pandemic was at a severe pace at the time, the MOH called on the public who were willing to volunteer to add staff to the hospital. They also added equipment such as ventilators, test kit, PPE for example, nose and mouth masks. Furthermore, the MOH also increased the capacity of service. For example, screening center, quarantine center, hospital to treat COVID-19 patients, the number of beds, and more to give full commitment to the people and the country. In addition, the MOH also conduct large-scale screening for at-risk groups such as elderly and chronic patients. Something happened, there must be disadvantage to be faced. There are some disadvantages of MOH that must be faced. Among them are the costs to be incurred during the COVID-19 pandemic. Minister of Health of Malaysia Khadijah Maruddin said the MOH has spent at least 593 million to buy additional equipment due to COVID-19 infection. Among the equipment purchased were intensive care unit ICU beds, ventilators, and additional medical treatment equipment. Other than that is debugging. It can be found on the application provided by the Ministry of Health, namely MySejahtera. Among the weaknesses of the application provided by the MOH is the lack of efficiency in arranging the vaccination schedule. This caused dissatisfaction among the people at that time. The issue they raised was if they had registered to be vaccinated on the MOH website, but their names were not registered on MySejahtera.
To conclude, the organization Ministry of Health, known as MOH, possessed a skill of great performance. For example, they tried to make all people were in healthy and provide good and effective health assistance. MOH work to ensure the welfare and health of the citizen. In addition, the citizens are required to pay according to their ability to receive treatment for the needy. The MOH is also aware of the people to get healthy. Thank you.